I'm joined by Ken Hogue, Senior Director of Revenue Cycle Management at New York United Health Services. Ken is a panelist at our upcoming Denials Mitigation program taking place on September 26th on a panel related to denial management strategies, an area where he has had considerable success. Ken, thanks so much for joining us. Could you start by sharing with us a little bit about your professional background and how you got your start in the healthcare industry and some of the roles you've enjoyed thus far?
Sure. So first, healthcare has been a part of my family, I think, since I was born. My grandfather was a provider as well, so within family practice. So first job really for me was like growing up within healthcare, kind of like seeing like the challenges, kind of helped in the office, would drop things off or kind of like help balance some of the things within the office. When I was like even a teenager in school, I was always like, I knew that I wanted to be in medicine, but I wanted to essentially be on the side to let the doctors and the clinical folks drive healthcare, but break down those challenges. As I always was interested in like laws, regulations, balance things. I'm like, kind of thought early on a lawyer, but then once healthcare kind of got complex, I was like, all right, this is kind of where you can use both sides of things to order to, help and really like bridge gap those deficiencies. So for me, I think like as well, starting, it's really about communication and then kind of being the mediator. I've always been, even early on in family, disputes with siblings and things like that, the mediator. So kind of getting to the facts and like stating we need to have a crucial conversation, like even earlier in my teens, I think, possessed in that. And then for me, I think, what also drove me to healthcare is it's never changing, right? So I grew up, my father is a retired military officer. I had to adapt to change very quickly when moving to different duty stations or different countries or across the United States. So for me, I think, that also just built the background of like, you have to adapt to change quickly. And then once I was in college, I really started to venture in kind of doing work studies, public relations, working with pharmaceutical, but that's where I kind of like fell into the revenue cycle area to where essentially I worked for the VA out of college and then helped with patients and really, the communication message of their benefits that the VA offered. And then kind of really started bridge gapping of what their insurance covers, if they're a service connected vet, and how to explain that. So that's kind of built the foundation really. And then ever since then, I think it's, average work week for me is probably 60 plus hours a week, has been for 15 years, but it's not unrewarding. And it's also something that I think I continue to advance forward because I want to stay on top of trends. I want to be that innovative leader and thinker and really adapt to things. So that's kind of the background, at least for me, of getting started and, really enjoy taking something that may be complex or circling and not resolved. And then how do we like break that into components in order to work through that to drive change and bring that to closure? Because I find a lot of times many people in healthcare want to resolve the issues and work together. It's just they may have a limited scope from their mindset of their work. So how do we challenge folks to kind of like bring things up further and then really offer it from different points of view in order to like drive change and just make sure like healthcare is getting better where we need to, and the challenges as well from patients are, breaking down, meaning like removing those changes, because too many people, I think, in that don't work in healthcare, it's so complex. Like how do we then like judge our audience, and then how do we also like help transform that, because many people are scared about healthcare or the expenses because of the complexity. So that's kind of where, looking at it from all angles again, I like talking to many different groups because then you judge the message for your target, but then really helping the more patient population truly understand and removing some of those barriers or the fear from what they don't know and really making it more transparent.
Certainly so many great points there, and healthcare is just so complex and always changing. And there's so many different people involved, but we've got to work together. In your current role as the Senior Director of Revenue Cycle Management at New York United Health Services, what are some of your main priorities for you and your team?
I'll tell you, it was an interesting story. So I think the key thing to put out here, I came to the organization in March of 2020 when we were in the midst of before COVID. We were also implementing Epic at the same time. We've implemented Epic at other organizations, but came to UHS to really help with the rev cycle implementation of Epic. So was challenged really within the first week of how do we send everyone home? How do we really drive those changes? And particularly like with denials and others, with staff working home, do they have the right tools? Do they have, the things that they need to complete their task accurately? And do we have a way to monitor? So for me here at United Health Services, I oversee the entire revenue cycle for hospital billing and professional. And with that, basically like everything with non-facility type of coding and HIM, that's kind of like a separate carve out that we have a counterpart to me. But I really, day-to-day operations help with the revenue cycle, financial health improvement, margin improvements, and really like pushing those envelopes of some of the challenges that we have and how do we like partner, how do we really have the subject experts that are helping us like make those changes so we can implement things quickly. But day to day, really, I think the key for me in this forum, it related to the denials is really like the tools. And I developed a strategic analyst team with different parts of the background. So, with that, I came from an analyst role and then I programmed or like built the applications within Epic earlier in my career. So really have used that to foster with my team here the technology side of our electronic medical record system, and then really like what the work needs to be done, and then how do we like confirm accuracy. So, designing both the IT footprint and making sure that that integrates with our staff. And then two, operationally, what do we have coming in? And then what are those variables that are controllable and not? Because like we all know within denials, there's a ton of data. So it's a matter of really like with my team efforts, we have an integrated group that combines both hospital billing and professional, but then we also look at it separately and then by affiliate as well, because we do have a critical access hospital and a safety net as well. So, with those different types of programs from a multiple hospital and multiple physician group, how do we really look at that data in order to drive like decisions? So from a day-to-day view for me, it's typically, meeting with each of those teams and the work efforts, setting the prioritization, like we mentioned about like for the week. And then when we have our larger payers that post like for denials, that's where, getting more into the forum and talking of that detail would be sharing with the group and those ideas of really the strategic analytics that have to be done and how to do them quickly. Because when you start to see things trending up, you have, the temperature gauge moves, and then that's kind of where you have to act very quickly, or you can have a large issue. So we have developed like a team under myself that came from operations within physician practice or the hospital, and then tried to have them fully understand the scope. And it's been a huge success for us. We, have lowered denial rates by 2 and 3%. We maintain within a less than 6% denial rate for the last year, even with a lot of the changes. But that's not to say like the hard work doesn't go in every day. But again, it's about that strategic kind of like acting on the data, validating, but then making it not overcomplicated to where we can't make a decision quickly.
Well, you've certainly had some huge successes, and reducing your denials is amazing, especially given all the trends that you see where everybody's going up and up. And we're really looking forward to having you join the panel coming up in September on denials management, an area where you've had some considerable success over the years. And I was really impressed with the work that you've done in creating a very collaborative approach to denials across your organization. And I wondered whether you could expand on how you've really fostered that level of engagement and focus with other teams and some of the results that the approach has had?
Sure. So I think first is the collaboration is the word that's key. And with that, it's removing titles, removing different areas like of an organization and really working together as a team because collaboration drives success. So with that, for our group, we had to understand our audience, right? Like of who within the offices, the surgeons, the CFOs were asking us questions. And then how do we deliver a result or a product or even, when you look at like a dashboard that's intuitive for all of their needs, right? And if you look within a system or reporting, a lot of times you can't develop just one. So we've combined multiple to be able to give like updates and work with those groups. It was more about building the relationships, I think, for about the first like 2 to 3 months that we were in this large like overhaul for the project and getting the buy-in. Okay, we have people reaching out from RevCycle. We have people that are trying to share the data with us, but instead of saying like, the physician side's falling behind or the hospital's not doing something wrong, instead of pointing out the wrong, we took a different approach and we're like, let's point out some things that we can help you with because we know everyone is short staffed. So instead of just here's the data, we need to improve it, the traditional method, we kind of took the open arms approach of we're noticing some things. Are you noticing them? Can we help you? And let us help monitor that so you know where you need to come back to this team and fully work as an integrated effort. And then for some of those more data mining or kind of like reporting needs, how can I then work with our analyst team for the entire organization to really like build a tool that worked successfully, and then as well as being able to give routine updates like every 2 weeks, and then really a drill down every month of what's actionable and not. So we did that by fostering the relationships, speaking of the data, trending out the last year, and then more particularly the last 6 months. But then we know with the post-pandemic, it even got more complicated because 5/11 with the PHE ending, some things reverted back to how they were prior. So we had to develop like an integrated team that understood that we had a baseline, but then you had to like have those variables that you're able to monitor or adjust because like the landscape changes quickly and we needed to be able to stay on top of it. So with it, it was building the relationship, pointing out the data, and then coming up with an integrated group of being able to have people able to speak in a safe space, open and freely of their challenges. And then we listen to that, and then we basically prioritize those into different like work streams or efforts for prioritization. We had almost 100 ideas come in, which is overwhelming, but then we had to kind of roll those up within different categories. And that's kind of where we were like, okay, let's start with the top 5 to 10. What can we really do? Let's scope these, but then we know that we need to make sure that we have resources aligned or reprioritize some of the projects that may have not have had as much value add to say, each month the group is going to focus on the overall metrics, but then we're going to focus on 1 or 2 deliverables that we really can work together as an integrated team. So key again, communication, team building, collaboration, fostership of setting the expectations so people felt safe, and then really the multiple touch points that had executive leadership like myself, but then even removing executive leadership and having some of our analysts pulse with the staff that do the work day to day and also the supervisors. So that way, if there were things that weren't bubbling up to this group, we could get that insight as well and putting a project plan together. And it's went over tremendously well. People at first were scared to speak up. Then when we pulled data to show some of the issues that they were having, they were like, so you're not going to tell me like we're not doing our job and I'm failing at managing this or whatever. And I'm like, we all know that things change. Many people are pulled in several different directions because of being short staffed. So that's where we're like, let's set the expectations and follow-ups for what's needed. And it's been very welcomed of people have the transparency, but then the team too, again, feels safe. But then we also close down those priorities that really may be a false priority. Like it can come, but it needs to be vetted, because you can't just kind of like work without proper prioritization for your team and work efforts, because you may undo some things that are done. And then we make sure that they're fully implemented, and then go back to look to see what other changes we may need to make, or are there other things that we had on that priority list that now could be like coincide with what we just implemented or some of the findings? And then we kind of make sure that those are grouped together. But that's where we have the subject experts from, clinical, from the physician practice group, from coding, and really revenue integrity, and then revenue cycle and registration. So we all kind of have one or two subject experts on this group, and then we do an open forum as well quarterly to share those updates, and then just get a general state of the union. Are we providing detail that leaders and managers and directors need? Or do we need to, like, is it too much data? Like, is it information overload? And then how we can kind of like get that out. And so we share those details all the way down to the staff level that work within the offices, and then get much more complex in our reporting to executive leadership. But people know of what items are being worked on, what improvements are being done, and really where they fit. And then if those improvements are made, then pulsing with that team and staff, so they know that like they make a difference, and really those ideas that were brought forward are acknowledged as well. Because like, I don't want to ever like shoot down the innovation of staff being able to bring ideas, or, they work it every day. They may start to see it before we see it in reportings. So it's really about that fostering a collaborative approach, and then pulsing, and really kind of having that open door policy, but then removing some executive leadership and key management, and kind of have more of an analyst to where they're not their direct supervisor or from the executive team, and can get like a true unfiltered result once we also have kind of like shared some of the updates to make sure everyone's understanding, or also if there's concerns that they have those different levels to share, instead of, I don't want to be the one calling out that there's an issue. We see improvement, but someone may see an issue within their area. So it's really about designing and setting the expectations so the group knows what forum to speak up in, and then to providing everyone a chance to have their voice. Because within revenue cycle, I think hospitals sometimes don't realize, or people do, revenue cycle really, once the patient's taken care of and charges are dropped, we're a part of the entire process, really. And more so the back end, you can have a great patient experience in the hospital, but if your revenue cycle isn't strong performing or providing those great services as well, it's a negative patient experience. So really understanding, how integrated they are, and collaborating that with the clinical folks was one of the things that we strongly had to build the relationships on.
And there are just so many great points here. Although I think my favorite one is that you had 100 ideas come from your initial, roster of let's put together some ideas, and you've got 100. That's really brilliant. And really, I think underscores how your team is collaborating and feels that they're able to say, this is a problem, like, can we get help to fix it? That's so wonderful that they don't feel like there's a sense of finger pointing, or you've done something wrong. Instead it's, let's work together to improve the
It's a
experience.
behavioral change as well, because I will say before, the group was not used to that. It was more, like, we need to get things done and complete them, and kind of like, here's the priority. But because the pandemic's really changed the way healthcare and revenue cycle particularly is, it's kind of where we had to kind of say, we got to rebuild this, and we need to foster something to where everyone makes a difference, because if not, your staff retention is also going to suffer. So that's kind of where we really had to make sure we were key to align these things. And then, at first, getting people to speak up was an obstacle, but those 100 items and prioritizing, once we had the right people in place, it took us about a month to quantify those. And then we were able to say, okay, this is in the holding tank here's, dollars tying to it, patient care or compliance or rebilling that cost additional work. So, with that prioritization that I talked about, we really looked at it from 5 different areas. And then we're like, okay, here's the 100. We've got the quantification in the data. Here's the top 10 we're going to do. Let's divide and conquer and come back. And then once the group kind of has a census of the majority, let's focus on those top 5 and bring them to closure. But then monitor the other items as well, because if they start to go up, for some of the others, then we may need to also adjust our priority as a team to making sure that we're helping the organization meet the financial goals that they have, but also for the team as well, if there is a larger issue to where they're not feeling like they're just spinning their wheel, that, they know if they speak up and start to see a larger issue, then that pulse or temperature changes. And that's where the group then can say, wait, we're starting to see this bubble up. We need to address it because it's going to be a huge issue if we don't kind of like address it now.